Hello, everyone, for another virtual shadowing webinar with WebCeph X. Today, we are joined by Dr. Awua-Mensah, a general dentist from Ghana. Thank you so much for joining us, doctor. And whenever you're ready, the floor is yours.
Thank you very much. My name is Dr. Michael Awua-Mensah. I'm a general dentist from Ghana. And I'm really glad to be on this platform. I would want to extend my heartfelt gratitude to Dr. Park for giving me this opportunity to have this webinar with everyone here. This should have taken place somewhere in July, but due to some technical difficulties, we're not able to have it, but we're having it now, and I'm grateful. Great. So in today's webinar, I'm going to give an introduction. Why dentistry? Why I decided to do dentistry, my life in dental school and the academic journey, daily life as a dentist, how COVID impacted my life as a dentist. I'll discuss 5 case studies with you. So the first 3 are actually my personal cases. The 4th one is a case I did with my team when I was working in the government sector. And the 5th one is actually a case that I felt is worth mentioning because it's gaining traction in Ghana. So I thought it's worth mentioning that case. So I'm going to discuss 5 cases with you. The other thing I'll talk about is the advice I'm going to give to dental students, so the pre-dents and as well as the students still in dental school. I'll give you some few tips. I'll do a conclusion. I'll provide you with my references, and there'll be a question and answer time. So you get the opportunity to ask me any question at all. So the brief introduction, as I said earlier, I'm a general dentist. I've been practicing for the past 5.5 to 6 years now. I'm Ghanaian. Yes, I'm Ghanaian, and I reside in the capital, and that's Greater Accra. And I'm an amateur golfer. That's what I do as a hobby. I get to network with people. I get to ease my stress through golfing. I'm also a columnist and a content creator. So the average Ghanaian would only visit the dentist when he or she is in pain. And by the time they will visit the dental clinic, they might have tried all sorts of herbal medications to try and ease the pain down. And sometimes by the time they get to the clinic, the problem would have worsened and would have to take out the tooth. They'll come with abscesses and swellings. So in a way to try and change this narrative, I've been creating a lot of dental content on social media. I write in the newspaper every week, a local newspaper in Ghana, just to try and bridge the gap, the dental awareness gap, and to get people to know more about their oral health. I'm also an active member of the Ghana Dental Association. So I'm sure most of you are wondering, where exactly is Ghana? Most people confuse Ghana with Guyana. There are 2 different countries. Guyana is G-U-Y-A-N-A, and Ghana is G-H-A-N-A. So Ghana is located on the coast of the Gulf of Guinea. It's in Western Africa. And we share borders with Togo on our east, and Cote d'Ivoire, also known as the Ivory Coast, on the west, and on the north is Burkina Faso. So the Republic of Ghana, we have our capital being Accra. We have a population of 31 million from the recent population census. We have, it's quite a small country. It's not too big. It's about 92,000 square miles. And our official language is English. And other African languages that we speak here is Asante Twi, Ewe, Ga, Dagari, Gonja, and Zema, Dagbani, Fanti. You'll be wondering why not French. Our neighboring countries actually speak French, but we are an Anglophone country. So we speak English as our official language. And you can see some images on the screen where you see something that says slave exits to waiting booths. And you see these old buildings in the slide. So let me give you a brief history about Ghana. So Ghana is actually the gateway to Africa, in fact, to West Africa. In the 15th century, the Europeans, that's the British, the Dutch, and the Portuguese actually came to Ghana, and they created these or constructed these castles and forts because Ghana was actually rich in cocoa, was actually rich. That cocoa is what is used to manufacture chocolate. Ghana was also rich in gold, diamond, bauxite used to make aluminium. So most of these Europeans migrated to the coastal aspects of Ghana, and to try and protect their trade interests, they set up these castles and these forts. And this continued for some time, but their focus changed from these things to actually slaves. So we decided to trade in slaves. That's where we actually started having slave trade in Africa. And this continued for a period of time. And when slave trade actually stopped, we still had our colonial masters, being the British. And on the 6th of March, 1957, Ghana actually gained independence from and we're actually an independent country. The major religions here in Ghana, Christianity and Islam, as well as some indigenous beliefs. The life expectancy for men in Ghana, that's 64 years, and 66 years for women. The currency is the Ghana cedi. So $1 is equivalent to 6.1 Ghana cedi. So I may quote some figures during my presentation in Ghana cedis and some in dollars. So at least you have a fair idea of what we actually spend here in Ghana. The dentist to patients ratio in Ghana is 1 dentist is to 104,000 people, which compares to about 1 dentist to 2,000 in many high income countries. You see this discrepancy. You realize that in Ghana, we have a lot of people, but we have very few dentists. But we are still doing our best to train a lot of dentists here, compared to the high-income countries where they train a lot of dentists and have 1 dentist is to 2,000 people in the population. Ghana is really an amazing country. If you plan on coming to Africa, I would suggest that you come to Ghana because we have so many amazing tourist attractions. We have the Elmina Castle, we have the Cape Coast Castle, we have the Lake Bosomtwi, we have the Menchia Palace, the Kintampo Falls, the Kakum National Park, the Mole National Park, the Kumasi Zoological Gardens, we have the Asha Fort Museum. So many amazing places in Ghana. Others include the Ibri Botanical Gardens, the Bari Beach, the James Fort, and the Larabaga Mosque. Yes, so the main topic, dentistry. Why dentistry? Why actually get into dental school? So for me, getting into the health sector was always a focus of mine, but I was not too sure of the exact profession to engage in. Trust me, when I was in junior high school, I actually wanted to be a mechanical engineer. I went to senior high school where I did science and I did more of biology, and I love the way intricate living organisms actually interacted with each other. So I knew that no, biology is actually a very interesting subject, but I was not too sure whether I was going to do how do you call it, dentistry or medicine or pharmacy, but I had to shadow some few dentists, like what you're actually doing on your platform. Now you do virtual shadowing, which is actually amazing, but during my time, I didn't have virtual shadowing. I had to literally go to the dental clinic, speak to dentists, get a fair idea of what exactly happens in the dental clinic. But you guys are quite fortunate. You tend to be in different countries, organize these programs, and we learn more from dentists from all over the world, which I feel is a good thing. So kudos to you all. So dentistry is a career that provides plenty rewards and challenges, as well as an opportunity to help people and make communities healthier places. So a recent report, a US News and World Report actually listed the professions in dentistry amongst its top 100 best jobs. So whether it's you being a dental surgeon, being a specialist in dental surgery, you being a dental hygienist, dental technician, the top 100 best jobs, dentistry was actually inclusive. So why dentistry? So as a dentist, you get to restore the oral health and transform the lives of patients. So whether you are providing preventative care, whether you are providing restorative care, that's making fillings, crowns, or bridges, or replacing somebody's teeth, or it has to do with orthodontic or orthodontic surgery, you're trying to change the jaw alignment or change the arrangement of teeth. You are transforming the life of a patient. He or she may not be comfortable with their smile, because bear in mind, the smile or somebody's smile is the first thing you see when a person starts to talk. So if you're able to transform somebody's oral health, you're actually transforming the life of the patient. You're actually giving the person more confidence. The person is able to talk very well in public. And a life in dentistry, or a profession or a career in dentistry, you get to be independent in your career. So take, for instance, you finishing dental school, you're able to actually enter the private sector. You're able to set up your own practice and manage your own time. You're able to manage the number of hours you work. You manage people around you. So you get to be very, very, very independent in dentistry. Yes, most of you are actually entering dentistry because of the money. Yes, you earn a very good salary as a general dentist, But if you decide to specialize, you go further to specialize in a particular field, you tend to earn more. So an average dentist, you should be comfortable, you're able to pay your rent, you're able to feed your family, you're able to pay the bills and all that. You're comfortable, let me put it that way. But it's not the type that you should be able to buy Ferraris, buy Lamborghinis every month. But maybe let's say the upper 1% of dentists in the world, those people are actually able to go the extra mile to purchase mansions and all sorts of buildings around the world. But the average dentist, you're comfortable, you're good. So I need to manage your expectations there. So you're also able to choose from a number of career options. So there are so many specialties in dentistry. Like the way in the medical profession, you can specialize as a urologist, a pediatrician, a cardiologist. It's the same with dentistry. You're able to choose from a wide array of career professions or career options. So you tend to become an endodontist, a restorative dentist, an oral and maxillofacial surgeon. I'll talk about all these careers at the end of the presentation. And you're also able to maintain a flexible lifestyle. When I say a flexible lifestyle, it depends on the specialty, because if you're in a profession like oral and maxillofacial surgery, which is similar to the medical profession, you hardly get time on your hands. You're always on call 24/7. Well, the other aspects of dentistry, you tend to maintain a flexible lifestyle. You know the number of days you work, the number of shifts you take within the week, and you're able to do other things apart from dentistry. So if you have a side business that you want to manage, you're able to do that as well. And you're able to shape the future of oral healthcare. Trust me, as a dentist, you're able to shape the future of oral healthcare. So if you're part of the faculty in your let's say your university, you're able to create a curriculum to help the potential or future dentists to actually come out as very good dentists. You have that power to do that. And if it has to do with research, if you're the type who's into research in dentistry, you're able to use advanced cutting-edge technology to actually learn certain things and change the face of dentistry. For instance, this material used in dentistry called a composite restoration is a tooth-colored material. It didn't just appear all of a sudden. It was as a result of constant research that researchers were able to bring composite material into the market, because in the olden days we're using the amalgam restoration, which is a mercury restoration that we used to fill teeth. It was a silver mercury restoration, but now we don't use amalgam anymore due to its mercury toxicity. But in dental school, sometimes you are taught how to use amalgam, but these days you use composites. So all this advancement in dentistry is as a result of the fact that there are dentists who came before us who are shaping the future of oral healthcare. As a dentist, you become a respected member of your community. When I say respected members of the community knows that as a dentist, you're providing expert care to patients. You're putting people out of pain. People tend to respect you because you're a dentist. So there's a very valid reason to actually enter dentistry. And also as a dentist, you tend to exercise creativity in your daily work. So how many of you realize that being a dentist, you're also an artist? You have the word artist in a dentist. And being a dentist, you're able to use certain materials to try and fix teeth. You're able to align teeth properly. You're able to do aligners for a patient. You're able to do so many things for a patient. And at the end of the day, these cosmetic or aesthetical pleasing procedures boost the patient's confidence. So you as a dentist, you're also an artist. And you're exercising your creativity in your daily work. As a dentist, you work as part of a team. The dentist doesn't work in isolation. You work with your dental assistant, you work with your receptionist, you work with your dental nurses, you work with the dental technician, there's a dental lab technician. You work with so many people in a team to try and find a solution to a patient's problem. You also work with other dentists. So trust me, there are certain cases that as a general dentist, you know that you can't do it. You refer to the appropriate department. So if it has to do with teeth alignment and you realize that probably with this teeth alignment, you can use you wouldn't be able to tackle it, you want an orthodontist to take care of that, you refer to the appropriate department. Or there's a particular case where it's a surgical, an impacted tooth, a wisdom tooth that doesn't grow properly. And you realize that this particular wisdom tooth, as a general dentist, even though we are allowed to do surgical extractions of wisdom tooth, there are certain ones that we realize that probably the apices of the roots are close to a nerve, such impacted wisdom teeth, it's best you refer to an oral and maxillofacial surgeon to do that. So as a dentist, you don't work in isolation, but you work as part of a team. Why dentistry? Another reason is that you get to provide benevolent care to your community. So as in dentistry, yes, you are providing care to people at the clinic, but most dentists like myself, we do outreaches. We go to certain institutions, corporate institutions, schools, to try and spread awareness, create awareness for dentistry, that's good oral care, and also provide certain free treatment or discounted treatment to people who don't have access. When I say access, in terms of geological access, they are far from dental clinics, and also in terms of apart from geological access, financial access. People truly don't have the money to visit the dentist. They don't have the finances to access good dental care. So with such people, you need to actually go beyond your means to try and provide expert care to such clients. So my life in dental school and my academic journey. I had my 6-year dental education at the Kwame Nkrumah University of Science and Technology in Ghana, in Kumasi, that's in the Ashanti region. It was quite a tough period. So I want to show you how to enter dental school in Ghana. There are 2 routes, actually. The first route is studying at a dental school in Ghana for 6 years. So in Ghana, we have 2 dental schools. The premier dental school is the University of Ghana Dental School, and the other dental school is the one in the Kwame Nkrumah University of Science and Technology. That's the latter is the one I attended. And after the 6-year dental education, you do a 2-year internship program. And this 2-year internship program, you are being supervised. You practice under supervision. So you're given a provisional license to practice with. You don't have a permanent license. You're actually practicing under supervision. You do all this before you receive a permanent license. And during your 2-year internship program, you should be in good standing with the Medical and Dental Council. So there are certain requirements that govern the Medical and Dental Council that you need to fulfill in order to qualify for you to practice. So after a 2-year internship program, you fulfill all these before you're given a permanent license to practice in Ghana. So the other route is for the foreign trained dentists. So for the foreign trained dentists, before you are granted a license to practice in Ghana, you have to actually show that you have knowledge in the English language, and you also have adequate professional knowledge and abilities necessary for dental practice in Ghana. So you need to satisfy the Medical and Dental Council to show that you have the skills, the knowledge, the skill set, the abilities of a practitioner to pass the council's exam. So the council actually lets you do, I think it's a 6-month to 1-year internship program, and you need to pass the council's exams before you're allowed to practice in Ghana. But I actually qualified to practice dentistry in Ghana using the former route. That's going to school for 6 years and doing a 2-year internship program. So I entered the university in 2010 after my senior high school education. In fact, I was among the 5th batch of dental students to receive the BSc BDS dental surgery at my university. So remember, I made mention that there are 2 dental schools in Ghana. That's the University of Ghana Dental School and the Kwame Nkrumah University of Science and Technology. So the University of Ghana Dental School has been in existence for a very long time. And the Kwame Nkrumah University of Science and Technology is a university on its own, but it got its dental department not too long ago. And I was a part of the 5th batch of dental students to actually train there. So I don't know how this compares to other dental schools around the world, especially in US, in Europe, and in Asia. But here in Ghana, the 1st to 3rd year of dental school, that's the School of Medicine and Dentistry, you do chemistry, you do medical genetics, you do statistical methods, you do algebra, you do communication skills, you do statistical methods, you do anatomy, you do biochemistry, you do behavioral sciences, you do microbiology, you do physiology, pharmacology, chemical pathology, and systemic pathology. So what happens is that your first 3 years, you do things similar to what your medical colleagues are doing in school. So the first 3 years, we do the same thing as our medical colleagues. We sit with our medical colleagues in class to learn all this for the first 6 years. However, when we are moving to our 4th year, that's where we do things that are skewed to dentistry. So from 4th year to 6th year, the School of Medicine and Dentistry, we have a little introduction to medicine and surgery. That's about 6 months. So we still share some few subjects with our medical colleagues, just to have a fair idea of how medicine and general surgery is. But after, let's say, the 4.5 to 6th year, 4.5 to 5th year, we branch directly into dentistry, where we do oral biology, we do operation technology, also known as optech, we do biomaterials, we do oral pathology, we do oral medicine, oral radiology, conservative dentistry, prosthodontics, and we do periodontics, orthodontics, and child oral health, oral and maxillofacial surgery, and community dentistry. So my dental school was quite stressful, I won't lie to you. Some courses were compact, and we used to have block lectures where we have these specialized lecture series where we need to actually accomplish a lot within 2 to 4 weeks. And after that, we know we are writing exams. This was probably because our dental department was set up not too long ago. We had certain lecturers coming from other countries to come and teach us, because we hadn't trained people within our area to teach certain dental subjects. So we had lecturers coming from Nigeria, from the US, from Europe, to actually come and teach us certain subjects in dentistry. However, I would want to say that our predecessors were super useful, because they used to impart knowledge to us. So certain things they learned, they actually taught us. They used to give us their slides, their presentations, their notes to learn before our lecturers actually came to teach us, which I felt really, really helped us. And trust me, in dental school, our assignments used to pile up. But the thing is, once you start to postpone these deadlines for the assignments, you get so overwhelmed with them. So one advice I would give is that whenever you're given assignments, try and complete it within a day or two, and use the rest of your days to try and learn other things. Because once you let these assignments pile up, you get very stressed in dental school. So my daily life as a dentist, as I said earlier, I'm a general dentist working in the private sector. I work from Mondays to Fridays. I don't work on weekends. I attend to all types of cases, but I refer peculiar cases to the appropriate department or specialty. So for instance, if it has to do with alignment of teeth, maybe if a patient comes to me with a severe alignment of teeth and all that, I refer to appropriate department. So I refer the person to another private clinic or another government institution where he or she can have certain expert care carried out. If it's a case that has to do with biopsies, there are certain biopsies that I do myself, certain incisional biopsies such as pyogenic things I suspect like pyogenic granuloma, but certain advanced swellings, those procedures or treatments, I refer to another clinic to actually have expert care and management done there. I actively participate in CPDs, that's a continuing professional development courses, regularly to avoid being rusty. So because as a general dentist in the private sector, you tend to see a lot of cases, you don't get time to actually learn stuff, but I try as much as possible to engage in some of these CPDs to learn approaches, ideas, techniques that will help me to manage my own learning and growth. But I still have plans to actually specialize. And currently, I'm thinking more towards orthodontics or probably oral and maxillofacial surgery. But as of now, I'm doing bits and pieces of all of them, but I'm not too sure of the exact one I'd want to specialize in. But eventually, I'll specialize. So the practice options in dentistry include practicing as a salaried employee or an associate. So in dentistry, if you're working at the private sector, you can decide to be an employee for your employer, or you can decide to be an associate with the dentist who owns the private practice. You can also decide to be self-employed in the private practice. So you can decide to set up your own private practice. If you've got enough experience, you set up your own private practice, you get a receptionist, you get an accountant, you get an HR and an administrator to work as a team, you get your nurses, or to build a team to work in the private sector. It's quite good. It's quite fulfilling. I've not set up my private practice yet. I'm actually a salaried employee of the dental clinic that I'm currently working at. And you can also decide to dive into the public sector. So diving into the public sector in Ghana means that you need to serve at a district. So you've got several districts in Ghana. Some of them are situated far away from the capital. So there are more skewed towards the northern areas, and we have some in the southern areas as well. But in such instances, you have to serve that district for some number of years before you can actually enter a specialized field. You can also decide to enter academic dentistry and dental education. So if you are the type who want to enter research, this would be ideal for you. You can also enter the public health care policy area. So if you're the type who likes to research a lot, you can also enter the public health area, because public health is actually a subspecialty in dentistry. If you're the type who would also want to enter the military, you also have the military dentistry, where you train with the military for some time, but you end up becoming a military dentist. In Ghana, you train with the military for about 6 months and you come out as a captain in the military. You can also decide to go abroad to practice. So in case you're not satisfied practicing in your country, for instance, you're not satisfied practicing in Ghana, you want to go to Europe, America, that's also another viable option. So in Ghana, the Ghana College of Physicians and Surgeons has 8 specialties under the Faculty of Dentistry. These are advanced dental education programs in Ghana. I know in US, they have about 15 specialties, but here in Ghana, we have 8 specialties. We have restorative dentistry, we have pediatric dentistry, we have orthodontics, we have periodontology. We also have oral and maxillofacial surgery, we have oral medicine, we have oral pathology, and we have community dentistry. I'm sure most of you are familiar with some of these advanced dental education programs. So when we talk about restorative dentistry, it has to do with fillings, crowns, and bridges, anything that has to restore the oral health of the patient, you do that in restorative dentistry. When it comes to pediatric dentistry, that has to do with the treatment of kids. So there are some people who are really, really good when it comes to kids. This would actually be a very good advanced dental education program for you. When it comes to alignment of teeth, that's when we talk about orthodontics. So orthodontic surgery, alignment of teeth, you do majority of that in orthodontics. And when it comes to the health of the gums and the supporting structure of the teeth, that's what we talk about when we talk about periodontology or periodontics. And oral and maxillofacial surgery has to do with pathologies and diseases. When it comes to the jaw, head, and neck, you're actually involved when it comes to oral and maxillofacial surgery. We have oral medicine, as the name implies, learning about certain things that affect the head and neck. There are certain conditions where you actually learn more about them. You prescribe certain medications to help curb such situations. And also oral pathology, learn about the pathogenesis, how the disease starts, and certain treatment modalities for such areas. And we also have community dentistry that has to do with more of public health. In US, there are 12 recognized specialties according to the National Commission on Recognition of Dental Specialties and the Certifying Board. We have dental anesthesiology, we have the dental public health, we have endodontics, we have the oral and maxillofacial pathology, we have the oral and maxillofacial radiology. We also have the oral and maxillofacial surgery, the oral medicine, orofacial pain, orthodontics and dentofacial orthopedics. We also have the periodontics, we have pediatric dentistry, and we also have prosthodontics. So when it comes to USA, I know they have 12 specialties, but in Ghana, we have 8 specialties or 8 advanced dental education programs. So how did COVID impact my life as a dentist in Ghana? So in the year 2020, when COVID hit the world, we realized that most dental clinics in Ghana, operations were temporarily shut down for elective cases and aerosol generating procedures, because we all know that aerosol generating procedures actually cause the virus to actually spread within the surgery. So we're not allowed to do any elective procedures or elective cases or anything that was aerosol generating. For instance, if we had to do scaling and polishing, that's a clean of teeth, we're not allowed to use the scaler to actually clean teeth. We were supposed to use the manual scalers the manual scaler instruments to try and remove plaque and tartar from patients' teeth. And anything that had to do with elective cases, like maybe broken teeth or those cases were more elective for us, so we're not allowed to do that because COVID was really taking a toll on our communities in Ghana. However, we're allowed to see emergency cases. So a patient with pain, probably we have to give an anesthetic agent, give an injection to reduce the pain, put the patient on medications to bring down the pain. We have to see such cases. So there are two lessons I learned from the COVID-19 pandemic last year. First and foremost, I realized that nothing is ever promised. Trust me, nobody knew COVID was going to strike us this bad. Nobody knew it. We didn't plan this. We didn't know that this was going to happen. So I realized that we have to make most of whatever we have now, because anything can happen from tomorrow, which can disrupt our plans. So that's actually the first lesson I learned. So I realized that whenever I have to do something, have any plan, I try to make it happen as soon as possible. I don't plan it and say that, oh, maybe I'm going to do this next month, I'm going to do this next year, I'm going to do this the last quarter of the year. No, I try to make plans to actually accomplish some of these deadlines as soon as possible, because you never know what any pandemic is going to bring next year. So you always have to put your best foot forward. I also realized that the sad reality of my colleagues in the medical field passing away while performing their roles as frontline workers, it reinforces the fact that the job, a job in the health field is actually a call to service. You should know that anything can happen at any point in time. You can actually contract an illness that could actually cause your demise. And I realized that most of my colleagues in the medical field actually passed away as frontline workers trying to curb the COVID pandemic. Rest in peace, all of them. And you should bear in mind that our job in dentistry and the medical profession is a job or a call to serve. So the COVID pandemic is really taking a toll on us. As at November 28th, I realized that we had 24 new cases in Ghana. In totality, we had about 130,120 confirmed cases, and we've had 1,209 cases. We've been struck as well. It's not been easy for African countries such as Ghana. However, we are doing our very best to do a routine surveillance, enhance contact tracing, and whenever people come to Ghana, we actually screen them at the airports, and we are doing our best to curb the COVID pandemic. And we're also administering doses of the vaccine. So far, we are doing majority of the AstraZeneca vaccine. We're doing the Sputnik V, the Moderna, the Pfizer BioNTech, as well as the Johnson & Johnson. So for the AstraZeneca, we give the first dose and then the second dose as well. And we're really doing our best to curb the COVID pandemic. This data I'm giving you was data as at 18th November 2021. So as you can see, the majority of the vaccines we're given here in Ghana is the AstraZeneca vaccine, and the least that we are giving here is the Sputnik. That's the lowest that we are giving here in Ghana. So these are some of the case studies that I'm going to discuss with you. The first case study is a client. This was a 92-year-old who presented to the clinic on account of missing teeth. And there's a lady who's actually worn dentures before in the past, but wasn't able to wear the dentures again because she wasn't comfortable with them. So she came to us and wanting new dentures. But the issue was that she had really bad teeth. There's some teeth that had to be extracted, some teeth that really had poor diagnosis or poor prognosis, for lack of better words, poor prognosis, and such teeth had to be extracted, and we made a chrome cobalt denture for her. And at the end of the day, retention was good, aesthetics was good, extension and fit of the denture was good, and she really appreciated this denture. So you can see the before, that's the upper picture, and the picture below is the after we did the chrome cobalt denture. And we had to incorporate clasps on some of the remaining teeth because we needed to actually put a very good retention by getting the clasp of those teeth. The second case you see on your screen is a client who came to me with a fractured anterior tooth. And in this case, this fracture actually occurred when he was, I think, around 8 years or 9 years. This is something common here in Ghana. You have children who have fractures of their anterior teeth. You don't do anything about it. They don't visit the dentist. They wait till they are older when they realize that aesthetics is of a prime concern, or if they realize that there's pain in the tooth. So with his case, it had to do with aesthetics and also had to do with pain. He had occasional pain with the tooth. So I had to do my vitality, or let's say my sensibility test on the tooth. After the sensibility test, we took an x-ray, realized that there was a bit of an acute periodontitis, but this was more of an acute on chronic case. So the periodontitis was there, the apical periodontitis was there for some time, but it was in an acute stage. So what I did was that I did a root canal treatment. I treated that tooth by doing a single visit root canal treatment. And this was not a rotary root canal treatment. This was done using the manual method. So I did a single visit. I obturated with my master cone and accessory cones. I sealed the tooth before I placed my composite material on the tooth. And even after that, so what you see on the screen is actually the before and after. The after is actually a composite material that I placed on the tooth, but I went further to do a crown on the tooth recently, which I didn't insert on this picture. I couldn't get pictures to display here, but what you see there is a composite material, or a composite buildup that was done for him. But ideally, after such cases like this, I prefer to put an Emax crown on the tooth for aesthetical reasons, and also to hold the tooth there properly. So the picture you see on the right is the root canal treatment that I did for this client. So the third case you see on the screen is a case of a patient who presented to us on account of fractured teeth, as well as peg-shaped laterals. So when I say peg-shaped laterals, I'm referring to these teeth on the side. You have these tiny conical shapes. So this was a 29-year-old who also presented to me with regards to aesthetics. Wasn't really happy with how her teeth looked when she smiled. And she had these fractured areas on the anterior segment of her mouth, which she wanted to actually have restored. So I did this with composites. So composite, as I said earlier, is a tooth-colored material that you use for fillings and also to restore teeth. So as you can see, I tried to get a very good shade for her by trying to match the composites to her her already existing teeth. And this was what I did for her. So this was the before, this was the after, this was the before here, this was the after, this was the before, the after, and then the peg-shaped lateral here to how to build it up with a composite material, and this is the after here. The fourth case that you see on your screen was a case I managed with my team when I was working at the government sector or the public sector. So this gentleman was in his 30s. He was actually assaulted at home. He was actually sleeping. He woke up and he realized that armed robbers had actually come to his house. They mugged him and they actually used a machete to cause all these lacerations on his mid-face, extending all the way to his left preauricular region. He also sustained a laceration on his left ear as well. They are quite deep. From the picture, they look quite shallow, but trust me, these were deep. These were really, really deep lacerations. So my team and I actually attended to him. This was quite late in the evening, around 11 p.m. As I said earlier, if you're doing a rotation in oral and maxillofacial surgery, you can be called at any point in time to attend to certain cases like that. So we were called late at night to attend to him. We actually examined him. We took a very good history to know exactly what happened, because without taking a good history, you may just be working blindly. So we took a very good history, did a very thorough examination. On the surface, we thought the laceration was quite shallow, but when we did a very good examination by giving local anesthesia along the area, we were able to examine properly, able to palpate to see that no, this laceration is actually deeper than we see it. So what we did was that we disinfected the wound, we debrided the wound, we cleaned up very well, and then we stitched up the client. So we started suturing the patient by suturing the deeper wounds before we started suturing the more superficial wounds. Because if you suture just the superficial wounds, over maybe 3-4 days to a week, the wound will gape again. So what you do is that after irrigating and debriding the wound to remove all sorts of contamination, you try to stitch up from the deeper layers of the wound, and then you work your way up to the superficial region. So the second picture you see here and the third picture you see here, these are the after. The one on the left is the before. The second and the third ones are the after. So when we're done, we clean them up very nicely. We applied some povidone iodine on the wound to help with the wound healing, and we reviewed the patient after the procedure. So after we finished the case, the following day we came to review. We did a second day post-op. We did a third day till about a week, where he was able to actually go home, make sure that there was no loss of consciousness during the injury, make sure everything was fine, both medically and dentally, before we actually discharged this patient. The fifth case study that you see on your screen, this, I would have really loved this to be very, very interactive. Anybody who knows what exactly this case is should please type it in the comment section if you have a fair idea of what this is. So I'm circling this. If you have a fair idea of this condition, please type it in the comment section. I know there's a bit of a 50-second delay in the presentation, but in case you happen to know what this condition is, I'll be glad if you could kindly type it in the comment section. And at least I have a fair idea of the knowledge base of some of these dental students and some of these pre-dents. So if you have a fair idea of what this case is, please let me know. Okay, so I'm getting some few answers here. I've got a first response. I'm waiting for a second or third response, and I'll delve into this case. Anyone? Any other person who knows what this case is? Anybody from the YouTube live section who knows exactly what this case is, please let me know. Okay, so I have a response from Now Oyo Glover saying that it's cleft lip. I have somebody else, Mark Anthony Sienka, also telling me that it's a cleft lip and palate. Now Oyo Glover also added that it may be a cleft palate. Okay, good. I have Idrisu Awal also telling me that it's a cleft lip. Oh, I have people going the extra mile telling me or classifying the type of cleft lip. I have Kakra Hagan telling me it's a unilateral cleft lip. Interesting. I have some Abdullah also typing in the comment section that it's a cleft lip and palate. I also have Mark Anthony Sienka also telling me it's a unilateral cleft lip and palate. Okay, so at least I know that the people or the audience have a fair idea of this case, but I wouldn't delve too much into it. I'll just give you a brief education on cleft lip and palate. So next slide. So cleft lip and palate, it's one of the most frequent congenital craniofacial deformities. It's quite common among Asians, followed by the Caucasians, and least common among the blacks. It has a mean prevalence of about 1:500 and 1:700 in Europe. However, it's also estimated to be 1:1,200 births in sub-Saharan Africa. Cleft lip and palate abnormalities vary greatly in terms of the width of the cleft and other characteristics. So with the classification of the cleft lip, so it's usually, should I put it as a deformity usually on the upper lip. So it's a slight division on the upper lip. So it can be a complete or incomplete cleft lip. And it usually poses certain complications to the newborn. So when it comes to sucking the breast for breast milk, such children have difficulties with that, especially whenever they suck the breast milk, it gets, especially if it's a cleft palate, it gets into the nose. Or sometimes when it's a cleft lip, they realize that you're not able to have a proper oral seal to actually suck. Such children also have issues when it comes to speech, especially when it's a cleft palate or a cleft lip. They have issues when it comes to speech. Some also have problems when it comes to swallowing. And it's quite common to have children who have cleft lip and palate also having ear infections, because you realize that the throat is connected to the middle ear through the eustachian tube. So sometimes any infection within the throat, you also have it in the middle ear. That's the middle ear or the inner ear. You also realize that children with cleft lip and palate also have issues when it comes to dental abnormality. Sometimes if the cleft lip is actually a complete cleft lip, it involves the alveolus, and you realize that whenever a tooth is developing and has to erupt through that area, it's not able to erupt well. So such children also have issues when it comes to the alignment of teeth. So the treatment modalities, it differs, and depending on the timing of the surgery and also the technique of the reconstruction. Bear in mind that, yes, dentists actually, or the OMFS, that's the oral and maxillofacial surgeons, actually deal with cleft lip and palate, but it's more of a multidisciplinary approach. It's not just the OMFS that's dealing with cleft lip and palate. You have other specialties that come together to actually make the treatment a success. You have the dental nurses, you have the plastic surgeons, you have the nutritionists, you have the pediatrician, you have all these specialties coming together, the liaise to actually make the treatment a success. So in developing countries, factors such as limited availability of specialized services, lack of awareness of treatment availability, superstition. I can't overemphasize that superstition. In Ghana here, most parents, whenever you give birth to a child with cleft lip and palate, most of them are scared. They feel that such children come from the sea. They are marine babies, and some actually kill the children. I'm not telling lies. Some actually kill the children, or they send the children to the outskirts of the cities because they don't want to be associated with such children. But I would want to commend two professors who actually taught me back in school. That's Professor Peter Donko. He's a well-renowned oral and maxillofacial surgeon, and Professor Dentistry. They really brought a lot of change when it comes to cleft lip and palate surgeries in Ghana. They've really changed this whole narrative when it comes to the superstition, when it comes to the lack of awareness. They are doing a lot in Ghana to actually change this narrative. I want to commend them. And you know, as a result of lack of money, some parents don't even take their children to the hospitals, but there are certain free surgeries that are done in Ghana that more or less coerce these parents to bring their children to the teaching hospitals to have the surgeries done. So these factors actually contribute to late or non-presentation for the surgery. You may be wondering what causes cleft lip and palate. So the cause is actually unknown. We have certain predisposing factors for cleft lip and palate, but it's more of an interaction between genetic predisposition and environmental factors. So some of the causes can be genetic. So for instance, if your parent has cleft lip and palate, there's a high chance that he or she may pass it on to the child, or maybe your grandparents or your great grandparents actually had cleft lip and palate. There's actually a chance of you transmitting it or moving it to another generation. And one other thing that you should also know about cleft lip and palate is that it can be isolated. You can have it like that without it being associated with a syndrome, or you can have it with a syndrome. So most of the cases we have in Ghana, they are isolated cases. They are usually not associated with syndromes, but the ones that are usually associated with syndromes, there's this popular case. I think it's it just slipped my mind. There's one popular case associated with cleft lip and palate. Just 1 minute. It just slipped my mind. I think is it the Pierre-Robin syndrome? Just a minute, let me just confirm. Just slipped my mind. There's this popular one. Yes, I was right. The Pierre-Robin syndrome, or the Pierre-Robin sequence, is one of the popular syndromes associated with cleft palate. So I feel you should know this. And since 1991, surgical treatment of cleft lip and palate deformity in Ghana has been provided to patients at the Confanochi teaching hospitals in Ghana by the local surgeons. But as the years went by, we have other organizations, non-governmental organizations, NGOs coming to the country to help with such cases, such as the Smile Train. They come to Ghana often to help with these cases. So in Ghana, we've also set up the Ghana Cleft Foundation. So it makes it easier for patients to actually visit the clinic to have certain treatments done. And it's even subsidized for them. It's really, really subsidized for them. And some don't even end up paying anything for the treatment. When it comes to the repair of cleft lip and palate, although the timing of cleft lip repair is contingent on a number of factors, there's this benchmark that we usually use when it comes to the repair of cleft lip. We call it the rule of tens. It was initially reported by Wilhelmsen and Musgrave. I don't know if I got the name right, in 1966, and modified by Millard in 1976. It recommended that the surgery should be delayed until the patient is 10 weeks and weighs about 10 pounds and has an HB of at least 10 grams per liter and a white cell count of less than 10,000. The reason for this criteria is because once you do the surgery following the rule of 10, this benchmark, you are 5 times sure that you're not going to get certain complications. It makes it quite safe for such cases. But when it comes to the cleft palate repair, it's usually done at around, let's say, 10 months to 14 months. That's the reason for it being 10 months to 14 months, is that it's delayed till the child can actually talk, or there's actually speech from the child, so that this actually coincides with the speech. So around in Ghana, around the 12th month, that's when the cleft palate repair is actually done, to coincide with speech, so that by the time the repair is done, the child can actually talk properly with a new palate. So my advice to dental students would be that you need to persevere. Trust me, the profession is not easy. Dental school is not a joke. I won't lie to you. You need to really, you should be really able to persevere. You'll face certain challenges, but you should be able to learn from these challenges and then move on. You should also have a sense of humility. So bear in mind that, yes, you'll be learning certain things in theory, but when it comes to practicals, your lecturer or your supervisor knows more than you. You should have the sense of humility to learn from your supervisor. I'm sure they'll pass certain comments which you wouldn't be happy about, but they are there to help you. So you should have the sense of humility to learn from your predecessors. You should also be honest. I can't take that away from you. You should be honest, because, for instance, you're in class, you didn't go for a class and you decide to lie about it. You let your friend sign in for you that you're not in class, but you still let your friend sign in for you, or you copy from your friend. Your lecturers actually see this. They know that you're copying, but they wouldn't tell you. Once you enter the profession, become a dentist, they now see that you are not a trustworthy person. You are not an honest person, because right from dental school, you had a habit of copying from your friends. You had a habit of letting your friends sign in for you when you know you are not in class. They notice these things, but they don't tell you. They wait till you become a dental professional, and you start to see it in the profession. You realize that you're not a trustworthy patient. What shows that during the profession, you lie that you did ABCD for a patient, but you actually never did that. You get it? All this shows in the profession. Are you willing to lie about the cost of treatment? Are you willing to lie that you did ABCD for a patient, but you didn't really do it? So honesty actually really goes a long way in dental school, and you should really be honest in dental school, because once you start lying, it follows through you being a dental professional. So what a career in dentistry demands, you should have good judgment. You should be able to judge right from wrong. You should know what is and what is not. You should be able to organize your time very well. You should have very good critical thinking skills. So when I say critical thinking skills, I don't mean you thinking harder. No, it has to do with you thinking better. So you should be able to have the sense of critically analyzing a problem. For instance, you're going to do, let's say, a surgical extraction for an impacted wisdom tooth. You should be able to think the case throughout. So for instance, you know the blade number you're going to use. You should know that, or maybe you're cutting you're incising the gum at this angle because of ABCD. You know that you've analyzed even before you even start. You've checked the X-ray, the panoramic X-ray. You check to see how close the roots of the tooth are to the nerve. You should know that probably you're going to encounter bleeding because the incision you're making is quite close to this artery. You do all this critical thinking even before you actually attend to the patient. And whenever you encounter any problem during the procedure, you are able to troubleshoot because you've read on the keys. You know what to experience, what you're going to encounter. All this comes together when it comes to the critical thinking skills that I'm referring to. So as a career in dentistry, you should have very good critical thinking skills. And if you even make a mistake during the procedure, you should be able to learn from it so you don't repeat the same mistake with other cases. And a career in dentistry requires that you should be a professional. You should be able, as I said earlier, you should be honest. You should be a very good professional because it requires professionalism. You should be able to negotiate during the profession. For instance, in the private sector, you can have insurance companies coming to you to sign you on. You should be able to negotiate very well. You should be an active listener. Negotiate very good fees with the insurance companies. You should also have very good networking skills. So trust me, in dentistry, you're not just treating patients. You should be able to negotiate, you should be able to network very well at the clinic and outside the clinic. So for instance, on social media, you should be able to network with other dental students or other dentists, network with other people, patients and all that. You should have very good networking skills. Your manual dexterity has to be on point. Dentistry is all about manual dexterity, whether you knit, whether you play video games, whether you anything you do with your hands, whether you do pottery, whether you paint, it's all manual dexterity because there should be an eye-to-hand coordination. Once the eye-to-hand coordination is very good, you have a chance of doing well in dentistry. And if you don't have the manual dexterity, you can still learn. It's not too late. And a career in dentistry also requires or demands that you maintain a continuing education in like CPDs. So for instance, as a general dentist, I attend CPD so that I don't get rusty. Even though I'm done with dental school, I still learn new procedures. I learn things that will make my job a bit more effective or let's say time efficient. So my other advice to dental students would have to do with the common personality traits of a dentist. You should be comfortable with close personal interaction. Because bear in mind, you're working in the patient's mouth. Your face, your hands are always in the patient's mouth. You should be comfortable with blood because there are certain procedures that you encounter blood. And the fact that you are in close proximity with the patient, there are instances that the patient may have bad breath. You should be able to be comfortable with it because you wear your face mask, you wear your N95, but you can still perceive the bad breath. It's not the case where you perceive the bad breath and you decide that you're not going to work on the patient again. No, it's all part of personal interaction. You should be comfortable with the client. You should be the type that is easy to talk to. When I say easy to talk to, you shouldn't be that stuck-up person that nobody can approach you. No, as a dentist, you should be somebody who's easy to talk to. You should be trustworthy. Bear in mind, the mouth is a very, 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 very delicate place. And as a dentist, you're working with very, very sharp instruments. Your patient should be able to trust that you're not going to use the sharp instruments to inflict any form of pain. You understand? So that trustworthiness between you and the patient should be there. Your patient should be able to trust you that you're not going to inflict him or her with pain. It's one common personality trait of a dentist. You should be a detail-oriented person. So the reason for me saying that you should be a detail-oriented person is that the mouth is a very small place. Yes, you're using loops sometimes to make the place look bigger, but bear in mind, you're doing root canal treatments and you see very small orifices. You're supposed to negotiate canals and all that. The mouth is a very detail-oriented place. So as a dentist, you should be somebody who likes to know details. For instance, you do a filling for a client. And after doing the filling, you need to check the bite, what we call occlusion in dentistry. So once you check the bite and you realize that, no, this filling is too high, You don't let the patient go. You need to reduce the filling to the point that the patient can actually bite well. Because any little discrepancy in the bite can cause your filling to fail. And it can also disturb the health of the tooth. Once it disturbs the health of the tooth, the patient now starts to complain of pain, or it can even have it affecting the way the patient chews. So you should be a detail-oriented person. Once you notice that, no, this filling is high, you need to reduce it. Or even if it's an anterior tooth, maybe you do a crown or a filling for a front tooth, you should make sure that the tooth is not in full occlusion with the lower tooth so that it doesn't break the filling off or it doesn't cause any issues with speech when the patient is talking or any issue with chewing. You should also be artistic when it comes to dentistry. You shouldn't just do any lame procedure for the patient. You should do really, really nice fillings for your clients. You should be a leader. You should be able to lead a team. As I mentioned earlier, in dentistry, you are not working in isolation. You're working with other people. You're working with your dental hygienist. You're working with your dental assistant. You're working with the receptionist. You're working with an administrator. You're also working with a dental technician, but you're a leader, you're a primary leader when it comes to all this. So you should be able to designate roles to such people. You should also be excited about the profession of dentistry. You can't be in dentistry and not be passionate about it. You will lose the zeal eventually, I'm telling you. You should be really, really excited about the profession of dentistry. You should also be passionate about providing care to those in need. So as I said earlier, apart from you working in the clinic, you should also be able to go and do outreaches to people who are less privileged. Such people don't have access to good dental facilities or good dental care. So you should be able to go out of your comfort zone to reach out to people who are less privileged and provide dental care to them. You should also be caring and concerned about how a patient feels during procedures. That's what I call emotional intelligence. You should put yourself in the patient's shoes. So for instance, you're doing a particular procedure, from time to time, you should be asking the patients, are you okay? Does this cause pain? Is this all right? You should be able to communicate with the patient to know that the patient is okay in the chair. Or you realize that there's an anxious patient or a nervous patient. You should put yourself in your shoes. What do you think would make the patient less nervous or less anxious? So in such a case, you can decide to schedule the appointment, maybe an early appointment, or you can even decide to play music during treatment. Maybe you find out from the patient his or her favorite type of music or favorite musician, and play music during the procedure. It makes the patient less anxious or less nervous about the procedure. So certain things that you do, you should have some emotional intelligence. Put yourself in the patient's shoes. See the patient from a different perspective. You should also be a good communicator. So when I say a good communicator, let me give you an example. A patient coming to you for dental care, you're not just doing dental care for the patient. You should go the extra mile to know the patient for who he or she is. Knowing, for instance, questions such as, oh, how's your day? What work do you do? How's it going? Is it good? Like, finding out things about the patient so the patient gets to know that you're not just concerned about their teeth, but you're concerned about their whole totality. That even tends to break the ice. It makes them less nervous or less anxious in the dental chair. So my conclusion would be that dental school is not about how smart you are. It's about how hard you are willing to work to achieve your dreams. So you can be the smartest in your year group, but once you start to practice dentistry, you realize that you need to be able to apply yourself. There are certain things that they don't teach you in dental school that you should know. You should be willing to apply yourself. You should be able to work hard to achieve your dreams and be the best at what you dream to become. So these are some of the references that I used during my presentation. You can have access to these to learn more about some of the topics that I actually presented. And you can contact me. I have my telephone number on your screens. That's +233. That's a Ghana telephone number, +233-267-000320. I have my email there. That's michael@drwa.com. I have my website. That's www.drwa.com. But it's currently under reconstruction. Recently, I had some people hacking into the site, so I had to close the site down to have it rebuilt all over again. But once it's up again, you can still access it and have access to an array of a wealth of dental content there. And if you're the type who's also on social media, on Instagram, TikTok, Twitter, you can access my handle. That's Dr. Dr.Awua. That's Dr.AWA on Instagram, TikTok, Twitter. I put out a lot of dental content there. I'm sure you'd really love that. I also have a YouTube channel where I review oral care products. I go on the streets and also interview people to see if they know about their oral care. I do a lot on my YouTube channel. I also do a bit of travel content there. So please follow me. Subscribe to my YouTube channel and hit the bell icon so you don't miss any of my episodes on my YouTube channel. That's Dr. Awua TV. You can also find me on LinkedIn at Michael Awua-Mensah. So in case there's anything at all, DM me, hit me up on Instagram, TikTok, Twitter, send me a WhatsApp message and let's talk. Thank you so much for having me on your platform. Any questions at all, I'll be glad to answer them.
Thank you so much, Doctor, for such an informative and eye-opening lecture. We appreciate it.
Thank you too for having me here.
Yeah, so we have a couple of questions if you don't mind.
Sure, that's fine.
So what is your most favorite thing about being a general dentist?
My favorite thing about being a general dentist is the fact that I get to meet new faces all the time. I get to interact with people. Apart from me being in the clinic, putting smiles on people's faces, I also get to impart knowledge to people. That's in terms of social media. I'm trying to change the narrative of people visiting the dentist only when they're in pain. I love my job. I like to do this as part of my clinical work. It's something that actually makes me want to do more. So the fact that I do clinical work that's putting smiles on people's faces, and that clinical work that's me spreading the dental education on social media, I get joy from this.
Did you think of specializing?
Yes, indeed. I plan to specialize when I don't move, but I actually plan to specialize probably in ortho or in oral or maxillofacial surgery. I'm not certain yet, but I may dive or do any of these.
It's very cool. So what is your favorite procedure to perform?
My favorite procedure to perform, I would say endodontics. That's root canal treatment. It's one of my favorites. Initially, when I started out as a dentist, in fact, after my 6-year education, root canal treatment was not my favorite suit. Trust me, I had challenges, but I learned from these challenges, and through that, I now like root canal treatment. It's actually one of my favorite cases at the clinic. Apart from root canal treatments, too, I do a bit of surgical extractions as well at the clinic as a general dentist, and I'm starting to love it because it's quite technical. You learn a lot of things from it. Maybe the way you handle a particular case wouldn't be the same way you handle another surgical extraction. So these are my two major cases that I like to do.
Also, could you talk about what a common day of a general dentist is like?
Okay, so a common day as a general dentist, unlike the teaching hospitals where you have the departments separated. So we have the oral and maxillofacial department, the restorative departments. As a general dentist working in the private sector, I don't have that luxury. Any case that comes, I see to it. I take a thorough history. I do a detailed examination. I see what I have to do for the patient. And there are instances where I actually met out the treatment on the same day. So if it has to do with an extraction and maybe the patient is coming from, let's say, a very far place, I can't let the patient go and come back on another day. I have to met out treatment. I need to carry out the extraction on that day and put the patient on medications. But there are instances where the patient can't afford the treatment. So you have to actually put the patient on medications and schedule the patient for another day. Probably there's a case where you have to do a crown or a bridge or any replacement for a patient. Such cases we see at the clinic. So I start my day at 8 a.m. So between 8 to 8:30 on Mondays, we have a huddle at my clinic where we talk about how the previous cases. So I do that to my nurses and administration as well. We talk about the cases we saw the day before, the week before, how those cases went were. We talk about the challenges we faced during the cases, anything we can do to make the company better or the clinic better, or anything that could make their job better. We talk about it, and we also talk about the cases that we'll be seeing that particular week. So between 8 to 8:30, you have a short huddle, and from 8:30 to 5, we in fact 8:30 to 4:30, we see cases at the clinic. We also have a lunch break between 12:30 to 1:30, because as a dentist, you get stressed a lot. You need to actually get something to eat and also relax before we see other cases. And between 4:30 to 5:30, we clean up the surgery, we sterilize the instruments for the following day.
Thank you. So any last minute advice to pre-dental students around the world?
So pre-dental students, I want to tell you that dentistry is a fulfilling job, but you should be really passionate about it, because there are certain hurdles that you actually encounter in dentistry. Once you're passionate about dentistry, you go the extra mile to actually find means and ways to actually jump these hurdles and also make the world a better place.
So that's all the questions we have for today. Once again, thank you so much for joining us, Dr. Awua-Mensah. We appreciate you taking the time to speak to us.
Thank you too for having me on your platform. I wish you the very best, and I hope that we'll become colleagues very soon.
And thank you to everyone who joined us today on our live stream. The post-session quiz for today's session will be accessible through our WebCeph website. And if you guys are new, we have a short video tutorial on our YouTube channel to guide you on how to take that quiz. And it's not up yet. It'll be up sometime soon today. But anyways, thank you guys for joining.